Good evening and welcome to the July 22nd, 2026 episode of the Doctor and Athlete Podcast. I'm Dr. John Harmon. I'll be your host this evening as I interview yet another doctor who is using this technology with his patients. We're excited to have him here tonight. But before we get started, I just want to say nothing the Dr. Prasant, nor myself say tonight should be interpreted or misinterpreted as medical advice. We're not purporting to treat, cure, or prevent any disease. Your results may be different than what Dr. Prasant talks about, or mine, or anybody else's, because we're all different. We're all different genetically. We have different nutritional profiles. So what we do want you to know is about this patch. This is the patch that really brings us together today. It doesn't look like a whole lot, but hey, combined with this, got the Stem Cell Innovation Award globally for 2026. So it's getting a lot of attention globally in its ability to activate pathways in your body to help us be the best humans that we can get. I call it, put the patch on, start your upgrade, get going. If you're not exactly perfectly happy with the rate at which you're aging, if you're not happy when you close your eyes and you think about, am I older or younger than, is my biological age older or younger than I am? Than my chronological age? How many years, how many birthdays have I had? Think about that. Even do it while we're talking. Close your eyes and just ask yourself that. Is my biological age older or younger than I am? Am I happy with the rate I'm aging? Now's the time to do something about it. What I know for sure is if we keep doing the same things, we keep getting the same results. And so if those things make you a little uncomfortable, listen up, because we have something that can assist in that tonight. You and anyone else who has come to these Zooms have been invited by someone else. Someone else invited you, usually for one of three reasons. Number one, you have something going on that you haven't been able to find answers for, and they thought this might be something that could help you. We don't treat, cure, or prevent diseases. Help you means activate my own body to take care of business. They thought it might help you. Number two, they thought, or they maybe saw you not having a lot of time for your family or for yourself because you're working so much. Working 2 jobs or 3 jobs, or maybe your job is one that's being threatened by AI. I don't know if you've heard the stats, but AI is purported to be as smart as humans by 2027. And whether that happens or not in 2027, it will happen. And if your job, and they say that up to 50% of the current jobs could go away. So if your job is that, here's what I want you to know. It's much better to build a plan B while you still have a plan A than the opposite of that. How do I know? Because that happened to me. I didn't have a plan B, and I was taken out of my plan A by a serious bone infection that almost took me out, and had to reinvent myself. I wouldn't recommend you do it that way. So take a look. It might be something that you see in addition to the benefits of your own body. It might be something where you see a global opportunity. And if you have one of these, if you have a cell phone, you can actually build a global business if you want to. It takes a little work. It's not just a piece of cake, but it's not a piece of cake being a barista either. It's not a piece of cake working in a factory. But if you can work from home or the beach, it's a lot more fun as soon as you're finished working, because you're where you want to be anyway. So with that little introduction to, one more thing. I am going to show a 3-minute video for those of you who are here for the very first time, because we want you to know what we're talking about and what this patch is, the basic information. So we're going to do that first, then I'm going to introduce the doctor. So this is the website. If you do decide to share this with other people, whythelight.com, you're going to scroll down. We're not going over all this information. Here's the video. It's a 3-minute video.
Light, the energy of life itself. Since the beginning of time, light has sustained us, fueled our growth, and shaped the world. Even Einstein recognized that everything we are is made of light. But what if we could harness the light within us, not just to live, but to renew, restore, and rejuvenate? As time goes on, we begin to show signs that things just aren't as they used to be. Energy fades, sleep declines, and healing takes longer. The reason? Our stem cells, the building blocks of renewal, become less effective over time. Since 2004, LifeWave has been delivering groundbreaking technology to help the body.
Dr. Hartman, I'm not hearing the video. I don't know if other people can or can't.
Introducing LifeWave X39, the first product in the world that activates stem cells using our body's own light.
I can hear it though.
Everybody hearing it?
Yeah, I hear it.
Doc, not your. Okay.
Yes.
All right.
Yes.
Thank you.
I'm hearing it also.
All right. Now I just got to be able to get to the button that will start this. I got to escape out of this first.
Backed by clinical research, multiple patents, and over 10 years of stem cell research, LifeWave's founder, David Schmidt, achieved something remarkable in the field of wellness and regenerative science that others, despite years of research and billions in funding, could not. The result? A revolutionary wearable light technology that unlocks the power of activating our own stem cells with a single, safe, affordable, non-transdermal patch that puts you back in control of how you look, feel, and perform. Here's how it works. Unlike traditional light therapy, which requires external light sources, X39 uses the body's own infrared light. When an X39 patch is applied to any point on the body, our infrared light is reflected back into the tissue, sending a signal to the brain, activating a powerful peptide, GHK, copper peptide, known to activate our stem cells. These younger, more effective stem cells then go to work, enhancing energy, relieving pain, improving sleep, accelerating recovery, and promoting healthier hair and skin. Unlike drugs or chemicals, X39 works naturally, awakening your body's ability to heal and thrive. Whether you want to boost energy for your busy life, recover faster, or simply feel your best, X39 supports your body's natural renewal process, helping you live long, live well, and live young. No matter your age or stage in life, your body is capable of more than you realize. It's time to unlock your full potential, restore your vitality, and embrace a healthier, more vibrant you. Be the light with LifeWave X39.
All right. With that introduction, that gives you, those of you who are here for the first time, a little bit of an understanding about this technology. It's not a drug. It's not a vitamin. It's not a pill. It's not a shake. It's not anything that goes into your body. It's reflecting back your own light. All right. I want to introduce to you, if I can get back to my page here, Dr. Lawrence Prasad. I asked him before, he said he goes by Larry, but I said, I'll call you Doctor. And so he is a board certified, he's a diplomate of the American Board of Venous and Lymphatic Medicine, family practice, American Osteopathic Board of Family Physicians, board certified. He passed written and oral certification exams in general surgery, He's also a member of the American Osteopathic Board. I was talking to him before we started. He has practices. He still has a practice in Arizona, but he's based in Colorado. You have to correct me if I'm wrong. Welcome to our podcast.
Well, thank you, Dr. Harmon. It's a pleasure to be on this Zoom. In my practice, I'd been using lights and laser therapy for a couple of decades, so I was familiar with phototherapy. And when I was first introduced to the X39 patch, it was from a patient of mine, and this patient would come from Florida every couple of years to come in to get a treatment in Arizona. And her husband called me. He is a world-class, world champion athlete, probably known to most of you, and gave me the pitch about the X39. And so what I told them was that I was going to do some research, because even though I knew conceptually about phototherapy, what I couldn't wrap my head around is how this little patch could utilize this type of treatment. So I did all the research. I sent copies of the articles to them, and he said to me, thank you for sending the articles, but they're all on our website. So
that's funny.
Yeah, it is. So anyways, we decided to give it a try. We had absolutely no expectations what would happen. And my wife happened to suffer from a digestive disorder for several decades, and it was pretty severe. A lot of inflammation, and really affected her lifestyle quite a bit. And I won't give you too many details about it, but she was on some very expensive medication, which did absolutely nothing for her. And eventually, being on the patch for about 3 months, she was scheduled to go in for a diagnostic procedure, and the doctor came out stupefied. He asked her what she was doing, and she says, "I'm waking up." "What do you mean?" He said, "No, I've been your doctor for all this time, and your colon looks like you never had this certain condition."
Wow.
And I'll call you in 3 days with the biopsy results. Called back and said, normal tissue. So we were absolutely amazed. And she went back for subsequent follow-ups every year, and she's remained in complete remission. I called it a miracle, but
I would too. Yeah.
Anyways, I was very motivated to recommend it to my patients due to the known beneficial effects with increased strength, endurance, reduced inflammation, decreased perception of pain, better sleep, and so forth. And specifically, the increase in collagen production, which comes from the copper peptide, which this patch has increased in blood serum levels. And by the time you're in our age bracket, your copper peptide and collagen production are down about 60%. So anything that would increase this, I felt would be really, really helpful for people, especially with vascular conditions. And there's collagen in just about every tissue in the body. It's the structural protein. It gives strength and integrity, especially to artery and vein walls. And so in recommending this to many of my patients, I felt, number one, if it thickened the thin vein walls, their spider veins and varicose veins would be less apparent. And a side benefit with arteries is that by strengthening arteries, it may help to reduce the incidence of strokes, hypertension, heart attacks. So I saw it as a very plus recommendation.
And Doc,
Yeah.
you and I spoke before, and obviously those aren't claims made by LifeWave, But if you turn to the literature, the science since 1977 about collagen repair, and therefore the arterial walls, the venous walls, they're stronger. And the other thing it is, it repairs elastin. So you as a vascular, a vein doctor, what have you seen regarding those things?
Well, what we've seen is after about 7 months of use, the veins are less visually apparent. And so the assumption is that there must be more collagen deposited in the vessel wall to make it thicker. Because when the walls get too thin, that's when they become transparent. And you can see the blood right through the vein walls.
I bet that's really fascinating to a lot of people on this call. What is a varicose vein?
Yeah.
Yeah.
Well, a varicose vein is a vein which has a weakness in its wall. And part of the wall becomes a valve. And these valves are like flaps which open and close. And when these valves become damaged or malfunctioning, then due to gravity, the veins will stretch and enlarge. And when they bulge and become of a certain size, we call them varicose veins. When they're tiny and just become very, very thin-walled and transparent, we call them spider veins. So those are the two main situations. So we found it very, very helpful. And I was surprised because I had patients calling me after several weeks and blessing me. And I said, what's going on?
Wow.
And they told me all sorts of things. Some people had arthritis in the neck and they couldn't look up and see the ceiling, and now they could look up and had more mobility, and some people, who had other conditions, noticed improvement. So it was something I've never experienced before.
And Doc, as healthcare providers, those words float our boat. I mean, we live for that. I get 2 weeks worth of endorphins if somebody says, something like that. I'm out in public. I'm retired now. They come up and say something, and then I'm just flying high the rest of the day. So that has to be really rewarding for you as well.
It's an unbelievable feeling of gratitude.
Yeah.
To have people call you up and express appreciation. I mean, there's no better feeling.
Yeah, that's why we became healthcare providers. Were you also in your family, did you have little sisters or brothers?
Yeah.
Were you the person who patched them all up when they skinned their knee?
No,
Like I
not
was.
necessarily.
I was always the one to come here, I'll fix you up, and washed off get all the sand out of there, and then we'll get a Band-Aid on it. So anyway, those things have always given me, joy. So
go ahead.
No, I was just going to say, this is fascinating that doctors, I didn't know what specialty you had, but doctors who deal with the the vascular system and cardiac things end up on this podcast, because those are the huge shifts that I had. I've had changes in my own varicose veins down by my ankles. I've had changes in, hey, when I take my socks off now, there's not this huge impression in my calf, and the right bundle branch block in my heart went away. So I've been acutely interested in anything that tells me why. LifeWave doesn't make any claims on that at all, but in the literature, it's shown that it repairs those things. It's 27 years before LifeWave even existed. So
well, the way I was trained, it was impressed upon us that the body has an inherent capacity to heal itself. It just needs guidance, needs a little help. And so whether you can correct the body anatomically or in other ways supplement it, the body kind of knows what to do. And so this X39 patch, is really a wonderful solution to help people. And I've been just really impressed with it, to tell you the truth. and I can't stop sharing it, with everybody I meet. I think
Yes.
everybody needs it.
Yeah, same with me. It's like people are walking around, and to be able to make a shift in somebody's life that takes them from they're kind of doomed, and I wouldn't judge anyone out in public, but some people we encounter are going to go into the slide into frailty and disability, and that means their old age maybe is sitting in a couch, sitting on the easy chair, staring at the floor. Not that we cure things, but if we can help them be the best they can be by putting this little patch, it activates it with light so that it can take care of business on its own. Then that's an easy share to me. So anything else you would like to say, Doc, an experience you had, or any kind of recommendation that you would have for anyone looking at this technology for the first time?
Well, I think what can't be emphasized enough is quality of life. And in my experience, I've seen hundreds, if not thousands, of patients who are bedridden, who are in nursing homes, and obviously the quality of life is not there. And people, are not really attuned to thinking about prevention. They say an ounce of prevention is worth a pound of cure. And usually what you see, in medicine, I practiced general surgery for several years before I concentrated in veins. People would come in with one foot in the grave and the other on a banana peel and say, fix me. And
Yeah.
by that time, it's too late. So I really have to emphasize people really taking a critical look at what their life may be like 10, 20, 30 years from now, and what they want that life to be like.
Absolutely.
It's never too early to start preventative care.
And folks on this call, just so you know, this patch signals your body to elevate that peptide that he was talking about, the carpopeptide, GHK carpopeptide. It's known in the literature to activate in our production of those stem cells. Stem cells are the engine that drives regeneration and repair. And the more you look at modern medicine and what that model is, the more you will turn away from that and more towards regeneration, or helping the body take care of business, rather than waiting until some part of your body's not working right because you didn't take heed early on. Maybe you said, well, I really like Diet Coke and Pringles and McDonald's food. Well, that's going to destroy your gallbladder. Well, I'll just have it taken out, or I'll take a medicine. So our message is help your body take care of business on its own, be the best you can be, have your vitality, your vigor, your brain when you get into that retirement phase. So it's not like a lot of people, you're retired and can't move around now, but he's retired. So I thank you, Dr. Prasant, for coming on. I think your message is going to resonate with thousands and thousands of people, because there are millions of people who suffer from those things, who could potentially repair a little cartilage. And also, everyone, we do this every Wednesday night at 5 p.m. Pacific. Invite your friends. I specialize here in interviewing doctors and top athletes. If you know of anyone who really needs to, tell their story, and we need to hear from them, please reach out to me at my email, dr. initial J Harmon, dr.jharmon@gmail.com, and we will get them on this show. And I would appreciate that, so we can continue helping get the word out about this really valuable engine that drives repair, and regeneration. Thanks a lot. We'll see you next week. Doc, I'll see you at the next event.
Absolutely.
Take care, everybody. Good night.